order. Noting that we have Dr. Walls, are you present?
Yes.
Thank you. Kristen
Yes.
and Jerry, are you present?
Yes.
And Rich Rydell, I don't think you are, but I'm gonna give you a chance here. Are you present? And obviously I am present, so we'll move forward and hopefully Rich will be able to join us in a short while. Well, I see the flag is posted here, so I'm going to lead the Pledge of Allegiance. But I was advised last time I shouldn't stand up as I do this because everybody lose sight of me when I do. So please follow along. I pledge allegiance to the flag of the United States of America and to the republic
United
for which
States of
it
America,
stands,
and to the
one
republic
nation,
for which
under
it
God,
stands, one
indivisible,
nation, under God, indivisible, with liberty and justice for all.
Thank you. I heard someone, kind of a time lag in there, so it was a little confusing for me. All right. First items on our agenda, I just want to let everyone know, I'm sorry, we will have a closed session a little later in the meeting, and then we will reconvene following that. And TK, I'm imagining that you will assure that our meeting at that point is confidential.
Yes, sir. The recording will be paused at that time.
Okay, thank you so much. So we are on item number 3, our public comment period. Do we have any members of the public present who would like to make comments? I'm not hearing anyone. Any board members wanting to make a comment? Okay,
And
yes.
I was just wondering, did anyone send any questions or comments in by email?
I have not received any. TK, Steve, anyone aware of anything that's come in by email? I'm not hearing any response to that, so I'll assume that nothing has been received. Okay. Moving forward, then we need to look at our minutes from our last 2 meetings, our April 30th meeting and then our special meeting on May 7th. I'm not sure if all board members have had an opportunity to review the minutes. If you have and have noted any changes, please let us know now. Otherwise, I'd entertain a motion to approve the minutes from April 30th.
So moved.
I will second that.
Okay, so Jerry has moved to approve and Dr. Walls has seconded. Kirsten, how do you vote?
Yes. Aye.
Okay, Jerry,
Aye.
Dr. Walls,
Aye.
and I will vote aye. And same piece with the minutes from May 7th, our special meeting. If there's any changes to be made, Steve, I know this is coming up on our agenda. So am I to assume there is a need in view of that for correction to these minutes or not? I'm not hearing you, Steve.
I think we need to approve the minutes as they are because that is what the meeting, how the resolution was worded at that time. I think with this meeting, then we'll be approving the new the dollar amount for the resolution.
That makes perfect sense. Okay, can I have a motion to approve these minutes from May 7th meeting?
So
So
moved.
moved.
Okay, I have that from Jerry and seconded by
Dr. Walls.
Dr. Walls. Okay. Kirsten, your vote?
Aye.
And Jerry?
Aye.
Dr. Walls?
Aye.
And I vote aye as well. Okay, that takes care of that. We have the med staff report. And I know that we have a whole bunch of new appointments to be approved, as well as some reappointments. So Dr. Ware, are you there with us? Who will speak to this?
Yes.
Okay.
So first off, we have credential files for the below, all of whom are emergency department locum physicians. And some of them are 2-month appointments because we're waiting on completeness of the application.
Okay.
And they were all in order.
Okay. Any questions, comments from the board?
I would move to approve this.
Okay, Dr. Walls moves to approve. I need a second.
I'll second.
I'm sorry, who was that?
Kristen?
Kristen? Okay, and Jerry, how would you vote?
Aye.
Okay, Dr. Walls,
Aye.
Kristen,
Aye.
and I'll vote aye as well, so we'll approve those. Anything else, Dr. Ware?
Yeah, the second part is the reappointment of the VRAD radiologist listed below.
Okay,
For 2 years.
questions for Dr. Ware? Okay, need a motion to approve?
I'll move.
Terry Nielsen moves to approve. Kristen seconds. Dr. Walls, how do you vote?
Aye.
Jerry
Aye.
and Kristen,
Aye.
and I will vote aye.
That's it.
I'm sorry, was there
That's
something?
it.
Okay, that's it? Okay, that moves us to item number 7, which is a policy and procedures special meeting. And as I understand this, that there is a good number of policies that need approval, and to actually so many that we probably want to do this at a separate meeting. So I'm not sure if there's a suggestion for a time, a date and time for the meeting or not. Anybody on staff have a suggestion for us?
Can you guys hear me now?
Yes.
Oh, okay. No, we do not. The video meeting has one plus. It creates great flexibility. So I think whatever creates a quorum for the board is something we could make work.
Okay, I can kind of kick off this some suggested times, only with my lack of availability. I cannot do it this coming Monday, but I'm pretty flexible for the balance of the week. Others?
How much time are we going to need to review the policies before we meet?
There's 72 policies.
It's not the time that we will spend reviewing them. It's the time we spend reading them before the meeting.
Right.
Right. That's what I'm talking about. Yeah.
So as long as they come out a week or so ahead of time, that's fine.
Okay. Anybody else have a suggestion? I was going to push for Tuesday or Wednesday.
I vote-
Tuesday is, I have a hospice board meeting, and I'd rather not do it Tuesday.
Okay.
Yeah, and I have committee meetings on Wednesday. So my vote's Thursday or Friday or the following week.
Yeah, me too.
I think
Thursday is fine by me.
Thursday is okay by me as well. Afternoon, morning,
Afternoon?
afternoon. Why don't we just go with our regular 3 o'clock time then?
Is this on Thursday the 4th?
Thursday the 4th, correct? Any objection to that?
Nope.
Okay, hearing none, let's schedule it for Thursday, June 4th at 3 p.m. I don't think that requires a motion. Okay. Okay, approval of the hospice medical services agreement. Steve, I'm going to turn that over to you. I know this is with partnership. You mentioned it at the treasurers meeting yesterday. Can you brief everyone on this agreement?
Okay, what we have before us is a proposed contract from Partnership Health Plan of California, which is the Medi-Cal Managed Care Program Administrator, and currently it is the Program Administrator for Lassen County and also Shasta County, among other counties. But in our immediate area, it's those two counties. We've been talking with them, or trying to make contact with them for quite some time, because one of the unique things about our area is that a portion of an adjacent county, Lassen County, lies within our primary service area. So and we're talking about Westwood. So the residents of Westwood that have Medi-Cal managed care or partnership have had significant restrictions on their ability to come to Seneca and Lake Almanor Clinic for services. And this contract will allow those individuals, plus there's a small population in the area code 96137 or 91367, I can't remember which it is, the Westwood, zip code that covers Hamilton Branch into the peninsula and into the country club. There's some folks that reside in those areas clearly within Plumas County that have been signed Partnership Health Plan, and really complicates their lives. This is a great thing it's one of those rare win-wins where it'll allow these patients to access health care in a more reasonable manner, especially in the winter. They won't have to go over the summit to go into the Susanville area. And then it also allows us to capture some of our market share that's been lost before. In the no good deed goes unpunished, or there's no free lunch. Dr. Walls very astutely pointed out that it will come with one complication, in that Butte County, where we do a high majority of our referrals for specialty care, is under the same plan as Plumas County, the Anthem and California Health and Wellness. So we're just going to have to be on top of doing referrals for any of these new partnership members, and we'll have to either work something out with the Enloe, or they can be referred and transferred to Shasta County. And so that's just an administrative on our end, but small price to pay. And of course, they can also be referred to Susanville, as they've probably been seeing some specialty care out of Banner. So I just wanted to make you all aware that this is a contract that we'd like to sign and get your approval, if you will. I did block out the reimbursement rates. That's proprietary information. I can confirm to you that the rates are no lower than the current rates that we have with Anthem and California Health and Wellness. So without that, any questions?
No question. I just want to make a comment that to me, this is just a no-brainer. I don't see why we wouldn't do it.
Yeah, I think this has been a long time in coming, and it's amazing. Thank you very much for working this out, Steve.
No problem. Next time I'm going to move the county line.
And Steve, I'm assuming there's probably a small number of people in the Clear Creek area that would benefit from this as well.
Very, very true. Very true. There's certainly an oversight on my part. We just get focused on Westwood, but yes, absolutely. Clear Creek, and then even some of the ranches or essentially anything west of Fredonia to the Plumas County line.
Okay, well, thank you, Steve. Can we get a motion to approve this agreement?
I would make the motion to approve it.
I'll
Dr.
second.
Walls, and who's the second by?
Jerry?
Jerry? Okay. Kristen, your vote?
Aye.
Okay, and Dr. Walls?
Aye.
Jerry?
Aye.
And I will vote aye as well. So, thank you, Steve.
Okay.
Item number 9, I understand we need to amend the resolution we passed at our last special meeting. Can you just speak to that, Steve?
Yes, I can. And then also, I guess I was having difficulty getting on when you approved the minutes, and I agree that absolutely the minutes are correct as they were presented. It was the resolution itself that had the error, so I think we're all good with that. We just had a small typo. We put $1,506,168 in the resolution, and the actual amount was $1,508,168. I've spoken with the legal folks about this, and this is just correcting a typographical error. And we provided materials to you, the loan documents that showed the $1,508,000. So I think we're going to be okay with just a motion from you guys to amend the resolution, and we'll do so, and we won't have to do a separate resolution.
Okay, perfect. So what we're looking for is a resolution to amend we're looking for a motion to amend resolution number 426 to reflect the actual amount.
So moved.
Okay?
Second.
Okay, the motion was made by Jerry and seconded by Kristen. Did I hear that right?
Yes.
Yes.
Okay. Dr. Walls,
Aye.
Jerry,
Aye.
and Kristen,
Aye.
and I'll vote aye. Okay. Moving along here. Financial report, Steve. Guess you're going to be with us for a while.
Okay. So this month we're presenting the April of 2020 financial report, and when we discussed the financial report for April in the treasurer's meeting, my goodness, what a month. We're all over the place. So I just looking at it from a analytical perspective, from a straight reporting perspective, we did report net income for the month of $3,084,783 versus a budget of $3,478,642. But there are a lot of moving parts in the month, not the least of which was that April 2020 was our first full month of operations with the impact of the COVID COVID-19 matter. And we reported total gross patient revenue of $1.4 million, just over $1.4 million. We had budgeted $2,552,000. If you guys recall from earlier months, we've been achieving below budget anyway, but this $1.4 million was even below our trend that we had been experiencing March, with only a partial impacted month was $1.7 million. February was $1.7 million. So that's kind of where we had been operating at. So we had a negative to budget anyway, a negative variance of $1.15 million. When we take it to net patient revenue, we obviously have a positive variance in deductions, and it nets out that we had a negative variance for net patient revenue of just under $546,000. The only good news in all that is that with the decrease in emergency department utilization, we did see a increase in our net revenue percent. It went from a budget in a year-to-date around 52% to just over 57%, so that was positive. Expenses remained, were just slightly over budget, and there's pluses and minuses. But when we get down into the non-operating revenue, we recorded our fiscal year 18-19 rate range. That's the supplemental payment for the Medi-Cal Managed Care Program, and that's kind of another thing, another benefit of bringing the partnership contract on board is that we'll have more claims and revenue and utilization considered when we look at the rate range, because the rate range is really under attack right now in the state budget. So there was, even still, there was a $247,000 negative variance, $3.25 million to $3.5 million budgeted. We did receive 2 payments under the CARES Act, totaling just over $415,000, and this was under the general distribution. So our non-operating revenue ended up being positive $170,000. So for the month, the net income we reported was at a negative variance of $394,000. Our cash, unrestricted days of cash on hand increased from 79.2 to 121. It was due to the receipt of one of the rate range payments. We received the amount from California Health and Wellness within the month of April. Then at the very 1st of May, we received the second payment from Anthem. So we've received both payments that are reflected in the $3.2 million. We also received a HQAF supplemental payment of $541,000, and then the CARES Act funding of $415,000. The accounts receivable came down around $335,000. Because revenue is going down, this didn't result in a huge decrease in the AR days, but the AR days did come down to 61.6. Any questions about April itself?
No one? It's really hard for me to just track this in light of the COVID situation. I know you're cautiously optimistic that we're going to have more Dr. Jensen there and revenues are going to increase a bit. Do you want to speak to that just a little bit?
Yeah. So I think the bottom line is with the funding that's coming through the CARES Act, in addition to the $415,000 that we received in April, we've received an additional $3.5 million. This is through a specific allocation to rural hospitals, whereby rural hospitals received a flat amount, a base amount of $3 million plus a percentage of expenses. And then we also received a much smaller payment, just under $50,000 for having a rural health clinic. When we put these funds in, along with the $1.5 million that we received for the PPP loan, that it's going to allow for us to ride out, absorb, however you want to characterize it, the financial operations we're seeing right now at around $1.4 million in revenue. And as Ken mentioned, we're already starting to see some increase in the clinic utilization. The clinic numbers are up. Dr. Walls is back. Dr. Walls closed down his practice during when we first instituted some of the infection control practices. He's back, and so we are seeing patients coming back to the hospital. As Ken also mentioned, Dr. Jensen today held his first clinic since COVID started, and we discontinued surgical procedures. He will do, sounds like a limited amount of non-general anesthetic surgical procedures starting next Thursday. We've seen some jump in our ER visits, but then on the same hand, when we got to work this morning, it was reported that over the past 36 hours, we've had 0 patients present to the emergency department. So there's really no rhyme or reason. Obviously, those of you guys that were out and about Memorial Day weekend saw the crowds. There are people here. We were starting to see some volume from that. It's just, it's so difficult to really put to project what it's going to look like. So we go back to this 1.4 million that we generated in April. We may not hit that in May. We'll be near it. It's certainly something, a small variance, negative variance that we can weather. So it allows us to continue to do everything we've been doing, protecting our hospital, protecting our staff, providers, and everyone that's here, and protecting our patients and community. So for now, it's we're reasonably confident that our course of action is prudent and is supported by the numbers we have.
Yeah. Steve, I'm wondering, my question is, and I noticed Rich has joined us, so welcome, Rich. Good to have you here. I'm wondering how much of this is how much community apprehension there is about going to the clinic or to the hospital given the COVID situation. And I am wondering if at some point there becomes kind of this pent up demand. You know, people have aches and pains, but they're just choosing to live with it until things settle down. Is there any sense of that, or any way to gauge that?
Well, maybe Dr. Walls could give his perspective, and certainly I believe Ann Holt's on the phone. But one thing that I could say is that we originally had four cases scheduled for Dr. Jensen next week, and we did a consent agreement for the patients to complete. And my understanding is that 2 patients were not comfortable with the circumstances surrounding the consent agreement. It's basically informing them of the environment and that they're saying we accept this. And so there certainly is some level of concern remaining. And when that releases, you know, again, maybe Dr. Walls or Ann Holt is getting a sense of that.
Oh, I think, Steve, I think there's no doubt about that. We're hearing patients say that all the time, that they just as soon not come into the hospital or the clinic because of this COVID-19 ordeal. They're just nervous to be around a hospital.
And I'm assuming in that there's no realistic way of allaying some of their concerns.
Not when the doctors feel the same way.
Yeah, exactly.
Have we thought about maybe doing home visits, Dr. Walls?
Yeah, well, Dr. Walls can speak for himself, and then Ann can speak about what's going on at the clinic on a larger basis.
Yeah, I think home visits are on a very limited basis. They just take up so much time, yeah, compared with seeing people in the office. And the facilities you have at home are just really restricted. I think all the doctors do home visits, but usually it's for people who are invalid, shut in, or terminally ill. But to just go out and see somebody for a sore throat, I don't think that would work.
Right. Anything else to add?
I'm just wondering if there's some other way we can reach out to those patients that do need services but don't want to come in. Do we know what other facilities are doing?
I think that the main thing is using telemedicine. I know myself, the last couple of doctor visits I've had down in Chico, I've taken care of over the phone. A few patients that I saw in April were all over the phone. And patients like that. If they can be handled over the phone without coming into the office, and they don't mind paying for it, they just don't want to come in and be around other people who might be sick.
I wonder if there's a way we can get that message out to the community in a more broadcast way so that they know that that's an option.
Yeah. Now, Teresa Nielsen has started every Thursday now, at least for this week and the last week, she's doing 100% telephone, whether you want to call it a visit or consultation. She's doing that 1 day a week. So she's at least starting that. We looked at this. The problem, well, I don't want to call it a problem, but the challenge is that yeah, telehealth is reimbursed. There's some limitations on what they're going to reimburse. In the case of Medicare, there has to be certain things that happen to constitute a face-to-face encounter, which allows us to bill it as a visit and get the full payment. In some cases, there may be a reduced payment, but I think that again, that we certainly wouldn't not do it just because of the finances, but it's not a one-size-fit-all or be-all for everything, but we certainly have continued looking at that, and like I said, Teresa is doing that at least once a week here, of just running her office through telephone or remote consultation.
Yeah, I appreciated Jerry's comment about making sure the community's aware of that to at least some degree. Otherwise, they might just forget that we exist out here and make alternative arrangements.
Hey, this
Okay,
is
so what I'll do is I'll get Lindsay Theobald on that to see if we can work with Ann as well. We've done that before, where we put on the pages about the availability of services and in general, and we can do something. We can. Okay.
Okay, we're just veering off a little bit on the financial report here. Any other questions about the financial report, comments about it? If not, I would take a motion to accept the financial report.
Ken, I'll make a motion, but I think somebody was speaking up on the phone who had a comment possibly.
I didn't hear anything.
It was Ann. I just wanted to quick add that Teresa sees telehealth patients every day, but Thursday is a full day of nothing but telephone calls.
Oh, great. Okay.
Thank you, Ann.
Yeah, good to let the community know that as well. Okay, so Jerry, you were going to make a motion to accept the financial report. Can I have a second?
I'll second it.
Dr. Walls seconds. Kristen, how do you vote?
Aye.
And Rich, you?
Aye.
And Jerry?
Aye.
And Dr. Walls?
Aye.
And I'll vote aye as well. And Steve, I guess you're still up. We have the HRG report.
Right. So the report is in your packet. I mentioned that the AR came down, the days are coming down. They're still outside of our range, target range of 45 to 55. We are making progress with HRG, and I have to admit some of their struggles are beyond their control. We've now run into some real significant barriers with California Health and Wellness, having issues processing claims, and it's just these things are an endless battle. We're feeling more confidence in them. I'm not ready to propose a contract to you all for their renewal. I would still like to see how much progress they can make. I would say we have to get something in place at next month's meeting, but I'd like to see where they go in one more month. We've seen really reasonably good collections in May, so I'm thinking the numbers will look, we'll have a third straight month of, or third straight month of improvement, and then have an idea how we want to structure the contract.
So what kind of challenges are they running into when they're doing their processing?
Basically, they're just saying that they're the ones that are messed up. The California Health and Wellness just says we're unable to process a claim, and they said that per the contract, they'll pay us interest when the claim's released, but that doesn't do anything for getting us paid. They're acknowledging it all on their end.
Or how far behind are they?
We've got, I don't know into the detail of claims, but we have large claims that are between 90 and 180 days, so 3 to 6 months.
Okay.
And those are claims at 25,000,
So are they
40,000.
Are they cherry picking and paying on the lower claims, the smaller dollar claims, and pushing the larger ones out, or is it kind of across the board?
Again, I haven't dug into the smaller claims, and nor have I asked.
Okay.
I just see it on. We get a report from HRG. They call it their high dollar report. It's any claim over $10,000, and they give us a detailed explanation of what's going on with the account, and it's littered with California Health and Wellness. On our call this week with HRG, they said that they finally have made contact with somebody at California Health and Wellness. They are processing, they say this week, or they're in the process of processing. How about that? But this is kind of their last thing. If they don't show that they are actually processing set for payment, then we'll go to our person who does our contracting and look at our not necessarily our appeal rights, but what are our legal rights? Can we go to the insurance commissioner? Can we go to DHCS? And so this is a contractor of Medi-Cal and the state. We'll look at the rights we have to do this, but this is their last chance, basically, is what I'm trying to say. That's California Health and Wellness.
That all sounds good. That's kind of where I was going with it. Thank you.
Okay. So that it for the report, Steve?
HRG, yes.
Yeah. Okay, so we'll move on to item 12, the committee updates. We have the bylaws committee. Jerry, as I understand it, we're going to set a special date for this. My mistake.
We can. I just got the minutes about a week ago,
Okay.
and I didn't have time to tighten up. So I don't think we necessarily need a special meeting, or maybe I can get that squared away and we can do it with our policy and procedure meeting if you guys want to. The one on the 5th, or
Others want to weigh in on that?
the 4th, I mean.
Yeah, it is the next Thursday.
Yeah.
The meeting, the special meeting will be next Thursday. When would we be able to get a copy of the bylaws?
I'll get them out tomorrow.
Oh, that would be fine.
Okay, why don't we agendize that as well then? Okay. Strategic planning, anything?
The only thing I have to report is I finally got to do something non-COVID, and did send the Collins land purchase agreement to our attorneys this week, and so we should have that back in time to take to you guys for approval at the June meeting.
Right. Okay. So, okay. And then the CEO search committee, I think we're just going to carry that over to our closed session.
We can, unless I can just briefly say, how many candidates applied and kind of the steps that we took up to the point of the stay-at-home order, but it's
Go
up to
ahead.
you. Okay. Yeah, so we did have 63 candidates apply for the position, either through Indeed.com or directly to Seneca. And the committee went through and screened those and pulled out what we thought based on based on paper, right, was their best, the best candidates. We would reduce that down to 15. We conducted interviews with 14 of those candidates on March 11th and March 13th. One candidate did not show up for their interview and they didn't respond to our inquiry regarding rescheduling, so we crossed them off the list. And then after those interviews, we had reduced the candidate pool down to 8 strong candidates that had planned to move forward with the next round of interviews that were going to include staff and community members. And our original intention had been to conduct those interviews before our March board meeting. And then of course, Newsom issued the stay-at-home order March 19th. So that's kind of where we were. And we put a pause on it and we let the candidates know that after this meeting today, we'd be giving them more information.
Okay.
I don't know if anyone
Thank
has
you,
any
Jen.
questions.
So for right now, how many active candidates do you have?
We have the 8 that we had narrowed it down to. The last I had checked with them was about a couple weeks ago, I think, and they were still interested at that time.
Other questions?
Yeah, what sort of criteria were you using to whittle this down?
We used the job description that the board had approved. We went through and we looked at their qualifications. We tried to find candidates that had critical access experience and rural experience, and we tried to find candidates with California-based experience as well. That was a lot harder of a thing, so we weren't really able to use that as a disqualifier.
Okay.
Anything else? Thank you, Jerry. Okay, Steve, this brings you back up, and I'm guessing we may have covered some of this stuff, but jump in, Steve.
Okay, so we discussed A and B pretty thoroughly. If there's anything we didn't discuss, something you saw in the materials that you wanted to talk about or have some clarification, we certainly can do that. The surgery opening, discuss the timing of it. We just gave you a copy of the agreed upon plan for doing this. We took it to medical staff. There was one clarification that we would not knowingly do a positive procedure on a positive patient that was anything other than life-threatening. So that was that. And then the last item is the PG&E shoreline power application. What we're doing is we're going to try and get if you want to call it, it's like a hardwired power for our MRI trailer. Right now, to get the right voltage or whatever it is, we have to use a generator, that white thing that's parked behind the building that sits there. And per our contract, we have to pay the rental on that, and it's $2,000 a month. So we worked with Aspen Street, Linda McCurdy, to get with PG&E about whether or not we could run the shoreline power, is what they call it. I just received their proposal this morning. There's a couple different versions in there because there's credits that are involved, that PG&E gives you refundable credits and all this, and it does change the cost of the project. One version is $18,000, another version is $35,000. So we've sent that on to Aspen Street to have them look at it and give a recommendation. So if it stays under the $25,000, we can move forward. If not, I'll have to bring it back to you guys for your approval.
Sounds like either way it'll pay for itself.
Yeah, and it's just, it's, I guess if you want to debate the reliability of power up here, but relying on a generator is not the best solution. So things sits out in the snow in the winter. We have to keep it running. So if we have to refill it, that could be a challenge. So it's just the wise, prudent thing to do, and financially it works as well. So I think we're all excited about it.
Thank you for this report, Steve. This is very, very helpful to me.
Yeah.
And thanks to the timeline, as you can see, reflects the efforts of a lot of people. 2 people, or I don't know, you always leave someone out, right? Lindsay Theobald has been accumulating our timeline, and then Linda McCurdy's been our lead on the activities and plan and putting together our formal plan, and Allison has been the one that's been tracking it, because things just change, they don't stop. The ink's not even dry, and then we change something. And so Allison's been tasked with keeping track of that, and then the infection control folks that have been involved in this, and Karen Turner with nursing. So it really is reflective of a nice team effort, and then Jim Koyman back to the HR stuff when we first started. So yeah, a lot of information, a lot of work.
Thank you.
Yep.
Okay. No other questions for Steve? All right, well, let's move on to the departmental reports then. As I go through this, we didn't get a report for quality improvement and care coordination, so I'm assuming there is not a report. We did receive a report from Sadie on compliance, and if you've had an opportunity to look at that, I'm wondering if anyone has questions, or if Sadie is with us, if she'd like to add anything.
Is Sadie on?
I'm not hearing Sadie, so let's move on then. We don't have anything from Karen in acute care. We did get a report from Ann Holt. So Ann, pretty brief, but questions for Ann regarding the report?
I just want to thank the managers for doing these reports, because they're very helpful. It helps us get an idea of what's going on behind the scenes that we don't get to see all the time.
Indeed, thank you. Ann, anything you'd like to add? Okay, and then we don't have a report from TK on the IT stuff. We did get a report on human resources from Jim, and identifying vacant positions and some changes. Questions related to the HR report? And I don't know if Jim's on the phone with us. Do you have anything you'd like to add if you're there?
I'm just glad we've added a radiology technologist.
That's right.
How do you do it? No, nothing to add.
Okay, thank you, Jim.
Okay.
All right. So we're on item number 15, items to be added to the next month's agenda. That would be our June agenda. Anyone? Board members?
I think there was some question about the quality care coordination reporting, the way it was done the last time it was presented. It was a bit confusing. Are we going to bring that back so that the board members can understand it a little better?
I see no reason why we can't. We just put it on the agenda.
I mean, do the other board members feel this way?
I think that'd be helpful, Dr. Walls.
Okay.
And
Agree.
I'm glad that Sadie's continued to bring this forward with the charge master. I'd like to keep on top of what's going on with that as well.
All right. We are at that point where we should probably take a 5-minute break before we move into our closed session. So what time do we have at the moment? It is, why don't we come back at, just say at 4 o'clock, okay? All right,
Okay.
Thank you.
Okay, for those guests who are joining us, I'll be putting you in the waiting room during closed session. If you'd like to stay on your device when open session resumes, I will bring you back into the meeting.
the board has concluded its closed session meeting. There was no reportable action taken, although the board did. The consensus was that we would move forward with our recruitment for the CEO position, and hoping that will be wrapped up sometime by July, our July meeting. So our next regular meeting is on June 25th at 3 p.m. I'm assuming there'll be another Zoom meeting. And we will have a special meeting next Thursday. Is that the 3rd? I don't have a calendar in front of me. The 4th.
The 4th.
Fourth.
At 3 p.m. So that concludes our meeting for the day. Meeting adjourned.
Thanks, everybody.
Thanks, everyone.